So we're sitting here with Lexis, and she just had a baby. So we're going to talk a little bit about the period of time leading up to the baby, things that she did to prepare herself for labor, strategies that she used in the hospital, and some things that she's doing postpartum to help with her recovery. So, leading up to the birth, did you do anything different than you did with the first baby?
So I would say I didn't necessarily do anything differently. With my first child, I incorporated like a lot of different stretching, like mobility things for my hips, stretching to help prevent tears. And I really tried to become as knowledgeable as possible. But of course, I still worked out every day. Well, I should say about 5 times a week. And I modified everything heavily. I would say I modified probably more the second time around than I did the first time around, just because I was a little less stubborn. But leading up to birth, no, I would say overall, I did basically everything the same.
What are some of those stretching exercises that you did or mobility things that you did that would help your body kind of prepare for labor and delivery?
Just different like hip opening stretches and exercises. So, like hip switches, I did a lot. I really tried to stretch my psoas. So, actually, the one thing that was a little bit different is I learned probably around 30 weeks. It was my third trimester ultrasound that I learned my baby was breech. So I guess that whole process was much different. And I started going to a chiropractor. And the chiropractor told me that basically my hip muscles were really, really tight, my psoas. So I really did a lot to open that up. Him getting Dr. Brandon from Ideal Chiropractic in Huron, he introduced me. Well, he basically did adjustments 2 to 3 times a week on me for about 2 months. And then he also encouraged me to do some stretches because my hips were just so tight that the baby didn't really have room to flip. So after I was doing all of the adjustments and those stretches, and I also learned some stretches from spinning babies, I was able to successfully flip the breech baby. So she was head down in an optimal position by the next time they checked me, probably at 36 weeks. 37 weeks. So that was very encouraging. That would be the one huge thing that was different. But yeah, just stretching my psoas muscles a lot, my hamstrings a lot, my hips to make room for the baby.
CrossFit always gets the perception of it's being very high intense. You have to work out till you pass out. You have to lift as heavy as you can. What are things that you did leading up to the birth that you kind of modified or scaled back in the gym, lifting percentage wise? Any gymnastics movements that you avoided?
So my first trimester, everything was on as normal. I felt really, really great. I would say my second trimester, I started switching to or eliminating kipping movements just due to abdominal separation. You're going to get some of that just as your belly grows naturally, but I didn't want to put any more pressure on my abdomen if I didn't need to. So I eliminated kipping movements in my second trimester. In my third trimester, I wasn't doing, let's just say I did strict pull ups in my second trimester instead of kipping or butterfly. By my third trimester, I was not able to do that because I would still cone when I jumped on the bar. So I would stick to ring rows or inverted rows. Running and jumping, I eliminated in the second, like halfway through the second trimester as well. There was just too much pressure on my abdomen and my pelvic floor. I just wanted to be really cautious of that. So I eliminated those movements and I just used a machine instead. I'm trying to think of like other big movements. But yeah, I still got really great workouts for my body at that time. And I just feel like intensity is relative to everybody, but it's also relative to yourself through different seasons of life. So if I would compare my workouts while I was pregnant to the workouts when I'm not pregnant, they're still all relatively intense workouts, but they were scaled to what I was comfortable and able to do at that time, which we do for every single person.
What about like when you're lifting? Typically, all the movements that we do in the gym are core to extremity movements, and we are constantly preaching to keep your core tight. Is there anything that you did differently on lifts to adjust for having a baby there?
Yeah, you said that, and I kind of forgot about that question. So, luckily, in my first pregnancy, I worked with a pelvic floor specialist that was a CrossFit coach as well. And so I learned a lot from her that I didn't feel like I needed to work with her the second time. But the two biggest changes I made in my first pregnancy and my second pregnancy with lifting were to stop wearing a belt after the first trimester. Um, because if you're wearing a belt and you're pushing on that belt on your abdomen, it's just extra pressure that you don't want. So, along with that, I kept my lifting percentages below 80% in my second trimester, and it was probably below 70% in my third trimester. Basically, what we're looking for is when you're lifting, a lot of times you hold your breath on the descent and you breathe out on your way up, like for instance, in a back squat. Well, when you're pregnant, you want to be able to breathe through the entire range of motion, because if you're able to breathe, then it's not putting as much pressure on your abdomen or your pelvic floor, which is really what the goal is. So I was able to do that and still lift, moderately heavy while breathing through the whole movement. Lifts like deadlift, my belly started to get in the way towards the end. So I would switch to a sumo deadlift so I had room for my belly. Things like push jerks and split jerks, I eliminated just due to the jumping. So I would do strict press instead. Since my baby was breech, I eliminated back squats and squatting for a period of time because I didn't want gravity to do its job when she was breech. But then once she flipped, I did all the squats to let gravity do its job.
Can you walk us through the labor and the birthing process that you went through this time? Any tips or pointers that you would give somebody else in the same position?
So I lost my mucus plug on Thursday. I forget the exact date, but I ended up having our little girl on Monday. So about 4 days prior to birth, I lost my mucus plug. and I was definitely feeling like back labor for the whole first, or for about a week. I was feeling back labor. On Monday morning, I woke up around 3 a.m. and I just like could tell that my back labor had intensified. And at 4:58 a.m., I had my first contraction. I didn't tell Brett. He was sleeping with our firstborn at the time. So I was just like, I'm going to like ride this out, see if it's a contraction, see how I'm feeling. So they were spaced out about like 10 minutes. Like I basically had 6 contractions in an hour. Well, at 6 o'clock, they started to intensify. And I remember texting Brett because he had his phone with our firstborn in bed. And I was like, we're going to the hospital today, I think. He texted me back, LOL, I'm going back to sleep. I was like, are you serious? So, anyways, I labored at home for about 2 hours. My contractions were like 3 minutes apart when we headed to the hospital. I'm very fortunate to have my doctor's cell phone number, so I texted her. She was like, head to the hospital, because the hospital was an hour away. Said, head to the hospital when your contractions are 5 minutes apart, because I was delivering at Fisher Titus, which was in Norwalk, compared to Firelands, where we delivered our firstborn. Well, Firelands is about 20 minutes. Fisher Titus is about 50. So Brett kept saying, I think we need to go. I think we need to go. But like my contractions didn't feel as intense as I remember with my first kid. So I was like, we'll be fine. Well, when they were 3 minutes apart, we left. The car ride wasn't too bad. When we got to the hospital, Fisher Titus was amazing. They, our doctor, Dr. Mona, she is phenomenal. She gave all of the hospital staff a heads up that we were coming, so they kind of knew. And we were greeted at labor and delivery by an amazing nurse, and we went into our room. At this point, the nurse wanted to check me to check for dilation. And when she went to check for dilation, I was so posterior that she couldn't feel my cervix, basically. So she called Mona, and Dr. Mona, actually called me and was like, so what do you want to do? And I was like, what do you mean? She was like, well, we can either induce you or you can go home. And I was like, I am not going home. Like, my contractions at this point were 2 minutes apart. They were intensifying, very intense. It was hard to breathe through. I was just like trying to say all my like birth affirmations through each contraction. And I was like, it's only like a 60-minute or 60-second contraction. Like, I can get through this, and then I'll have like, a 1 to 2 minute break. So that was very helpful. But by the time Dr. Mona came to check me for dilation, which was about 3 hours later, I was 3 centimeters dilated. Mind you, during that period, the nurse gave me a birthing ball, and I wasn't hooked up to a monitor, so I could like move around the room, which was, it was like a cordless monitor, which I did not experience that at Firelands. So it was really wonderful being able to move around the room. So when Dr. Mona came to check me, it was around 1 p.m. at this point. I think we got to the hospital around 9 or 10. So we were there for a few hours. I was just like laboring, doing my thing. When she checked me, I was 3 centimeters. So that was great. I wasn't as posterior, and I think that was due to our amazing nurse, because she gave me the birthing ball, and I didn't feel as much back labor anymore. So
She had you in different positions, right?
After, yeah. So at 3 centimeters, Dr. Mona broke my water. She asked me if she could. And I said yes. It didn't hurt at all. I was expecting it to. I couldn't even feel it. So then I was instantly 5 centimeters. And they asked me what I wanted to do, if I wanted to get an epidural or not. And I decided at that point that I would do an epidural. So around 2 o'clock, I got my epidural, and our nurse put me on different positions on the table with a peanut ball to help really bring the head down. So the epidural obviously worked. I was super happy to not be in pain. It was pretty easy going. The next time the nurse checked me, she was around like 4:15, and she was like, "Oh my gosh, you're ready to push." She could literally see the head. So she called Dr. Mona. Dr. Mona came over, and I had her in 3 contractions, so like 9 pushes. The one thing that I forgot in that whole story was when I was getting my epidural, Brett almost fainted. So that was fun. He was ghost white and started falling on me. The nurse had to catch him, put him back in the chair. It was hilarious. It took everything in me to not be laughing because I didn't want to get paralyzed. It was hilarious. So yeah, our little girl was born at 4:58 p.m. on Monday. So I'm exactly a week postpartum today.
Any advice for anybody that's going through like contractions? And in my defense, like that needle was gigantic, and I hadn't ate anything all day, and we'd ate like shit leading up to that. So yeah, I was I knew I was getting to the point where I was probably gonna pass out, and I knew that if I said I need to sit down, I was never gonna hear the end of it. So I was just trying to ride the wave, and I got told to sit down. So there's that.
I would say just like breathe through it. I told myself like to not clench my teeth, breathe through it, and then I made a list of birth affirmations on my phone like you are strong, you can do this, you were made to do this. Like each contraction is going to bring you closer to meeting your little girl or little boy. And like truly repeating those in my head helped. Had I known that I would have I would have only been in labor for, 1 or 2 more hours, I could have probably went without the epidural, but it's just so hard to know.
What was the other reason you got the epidural?
The other reason I got the epidural was because my first pregnancy, I had a 4th-degree tear, which is like almost worse than a C-section. And if I didn't have an epidural for my first pregnancy, they would have had to take me from the room and stitch me up like in the OR, basically. And I was really worried that that was going to happen again because my scar tissue was just really thin. Luckily, our doctor who delivered our little girl just had a different technique about pushing. So I actually like breathed through my pushes, so I wasn't pushing like as hard. And also I wasn't pushing for as long. Labor was just a lot shorter and a lot quicker. So I didn't end up with a 4th-degree tear. I still had a 2nd-degree tear, but that's pretty normal, and I feel like a million times better than what I did after my first pregnancy. So.
And they used the salad tongs to get them out, right?
They used like the forceps in my first delivery. It like just comparing the two hospitals was different. I My experience at Firelands was amazing, but I didn't realize how good it could be until my experience at Fisher Titus. And a lot of that has to do with just filling out my consent form. um from the get-go, we were very, very explicit about everything we wanted, and the nurses followed that to a T. Like every single time that they had to touch our baby, they asked permission, and that's exactly what we wanted. So they followed through on that, which in our first pregnancy, I can't really say that they did it as seamlessly. We kind of had to remind them about a lot of things. So it was just a seamless process there from the very get go. And then, like I said, our nurse put me in different positions, which I never was offered at Firelands. Like, I had the birthing ball, the cordless monitor, and then just putting me in different positions to help bring the head down, like on my side, and doing like these different stretches where like sideline release. Um, Different things like that really, really helped. So I wasn't just like sitting in the same position for so long. And then, of course, the way the doctor delivered helped as well. So all of those things were much different, and I think it aided in a much easier delivery, a much quicker recovery process.